in kind of thinking about today, what I can put together for us is a little bit of an arriving practice based on one of the practices that was in this module in the course and a bit of an expanded form on that. And then a little bit of a teaching that I put together based on some of the practices that I learned from my primary EMDR consultant and mentor. His name is Jim Knipe, and he is here in Colorado, and I had the opportunity to do consultation with him for many years. And his specialty is in working with complex PTSD. And I want to share with you kind of the two protocols that I use more than anything else in my EMDR work. And they're in some ways, you've already seen them in the course, but I just want to kind of highlight a little bit more of his contribution to those protocols and how they've influenced me in my working. And one integrates compassion-based practice into EMDR. The other one is a pendulation-based practice or titration-based practice that he brings into EMDR. And speaking of pendulation, I'm going to kind of roll back to the oscillation of attention practice that I discussed within the course and that we'll do a little bit of a practice with here today. And I initially learned this practice from Christine Caldwell, who was the founder of the somatic psychology program at Naropa University. Has anyone here worked with Christine at all in the past? Anyone familiar with Christine's work? So she not only founded the somatic psychology program at Naropa, she has written, I don't know, many books on somatics and addictions, somatics, and kind of a wide range of how we bring this into the work. She calls her work moving cycle, the moving cycle. And she integrates Gestalt and somatics in some lovely ways as well. And a lot of what her work is based on is this idea that there's this kind of arc of a session or arc of transformation that we can see within sessions, and that arc follows what she would call an awareness phase of therapy, where we're kind of deepening an awareness of what's happening for us or for our clients, what's happening in the body, what are the emotions, what's present, what are we bringing into the room. And then kind of similar to Eugene Genlin's focusing work, she invites an individual to choose kind of one of those areas of awareness, one area of maybe disturbance or challenge to deepen into. And she calls that the owning phase, where there's this opportunity to really immerse one's attention into the experience of what's happening in the body, what are the emotions, maybe there's a memory connected to that, and we get very immersive with our attention. One of the ways that she invites that immersiveness is she describes slow down around a sensation, amplify it or exaggerate it, so that like once we feel it, we go toward it and we actually contract around a sensation. So if there is tension or contraction, get to know it by meeting it, by actually contracting further into it. If there is a shape of the body, exaggerate it further as a way to kind of increase your mind's awareness of what is happening. Now, when we go towards something, when we immerse our attention into sensation, sometimes that can be too much too fast, right? If there's a lot of emotion, if there's a lot of sensation. And so she also introduced this idea that we can oscillate our attention towards that immersion into an experience and then kind of back away into more of an observing or witnessing capacity. And so that's one of the layers that I'll kind of bring back in today is this oscillation of our attention. We can also oscillate between turning towards an internal felt sense and oscillate back out into, okay, I see the room around me. I see you. I see some cue that lets me know that I'm safe enough so that perhaps I do go back into internal with my awareness towards sensation, emotion, inner experience, memory. And then she also invites this dichotomy between, okay, we've got immersive observing, we've got internal, external, and the third dichotomy would be very focused with our attention and very broad with our attention. And she calls that focused panoramic. And and kind of building what we might even call the muscle of attentional flexibility, if that's a muscle, but like we're strengthening attentional flexibility, which has been shown to be a marker of resilience. That when a memory comes up, I have choice about whether to attend to it or focus my attention elsewhere. When a strong emotion is here, I have choice about whether to immerse myself in it or observe it, right? Neither being right or wrong, but just knowing right timing and how, where do I want to place my attention at any given time. All right, but going back to Christine Caldwell's moving cycle work and the arc of that. So there's the awareness phase, there's the owning phase that lets us deepen, and we might need to titrate as we deepen towards sensation or an experience, but we deepen towards an experience. And that what she says happens next is a natural, um, kind of organic experience in which and she's, we've all kind of seen this, in which there is this very natural, deep appreciation for what our body has been carrying for us, or for like I'll just speak it in us terms, but of course you can translate it to the client. But like there's this moment of like, oh my gosh, my body has been holding this for me for so long. I finally am able to feel it. And there's just this natural like kind of thank you that comes out. Or there's a feeling of, wow, you stuck with me through that big feeling. I feel so grateful. Or I had so much courage to go towards that, even though it was scary. I feel proud of myself. And she calls this the appreciation phase, that's kind of part of this natural arc of the healing process. Awareness, deepening with owning, and appreciation. And then the fourth phase is what she calls the action phase. And I think this is really essential and very cool. That built into the model is not only, yay, we get insights in therapy, fantastic, but how do we take those insights into action? How do we put those into some kind of action phase? And she calls this the action phase, where not only do I have some new sense of myself or some new belief about myself or some sense of what's possible in my life, but we really take the time in the action phase to explore what are the barriers to integrating that new insight or awareness or a new way of being into your world, and how do we work together to kind of overcome those barriers and help you really integrate this new sense of self in your relationships, in your workplace, in your parenting, and in your how you talk to yourself, whatever it might be. I've known Christine now for, gosh, almost 30 years. We met in 1996. And I've had the joy of watching her work continue to expand. So she added the immersive observing domain to this more recently, even since I offered the original course. So it gets to be added into your toolbox as well. But it just, I think, sometimes helps to see that what sits at the center of all of these polarities, internal, external, focused, panoramic, immersive, observing, is the witness. And that's what we're building our capacity for, that attentional flexibility that the witness is capable of observing, where is my attention flowing? Where is it comfortable? Where is it habitual? What are my attentional habits or conditioning? And how can I be more mindful about that? And that ultimately, when we kind of have this ability to transition across these different domains, it helps us hold a sense of self and the world around us simultaneously. It helps us see the details and the big picture of a situation at the same time, which is pretty phenomenal, right? And it helps enhance our capacity and choice to move towards an experience or distance ourselves from an experience as as is needed for any situation or for our own well-being. Um, I remember when I first learned EMDR therapy, and we learned the value of the distancing interweave in EMDR therapy. It's kind of built into EMDR. And basically, what distancing means there is that if it feels overwhelming to observe a traumatic memory and it feels like it's bringing in some quality of re-experiencing the memory as they're working with that memory, distancing, we have all these different techniques. One is like imagine you're on a train and you're looking it out the window and you're going by and you can like look out the window at it and that it can change as you continue to move. Look at it on the screen, and you are holding a remote control for that screen and you can turn it on or off. Look at it in a movie theater and you can decide how close or far away you want to be to that memory. Do you want to be in the middle of the theater, in the back row, in the projection box, outside of the theater, looking just through, just to see enough of what's happening on that screen so you can get very creative with observation versus immersion into memory work. One of the things that we do within EMDR is that we integrate the bilateral stimulation. And when we talk about this target development or target identification, which is phase 3 of EMDR, this is the typical target development script where we work either from a current symptom or a historical trauma target. And we identify what is the image, what do you think when you think about that negative image and what happened to you back then? What are the beliefs that come up about yourself? What would you like to be able to believe about yourself when you think about this? We place the truth of that positive cognition on a 1 to 7 scale, where 7 is completely true. We identify the emotions, how disturbing those are or sensations are when you think about the focus of the session, the symptom or the target. And a 0 to 10, where 0 is no disturbance and 10 is the highest possible. And then we go towards the body and we get to go right in and start to add the bilateral as we're working towards that felt sense, the emotion, the image, and the negative belief. And the way that this is described, and I'll take this down for a moment, um, the way that this is described is that we're lighting up the neural network of the traumatic memory when we bring in the image, the negative belief, the emotion, the body sensation. And when we think about a trauma-related memory, it's like taking that file from the recesses of where it's held in the amygdala or the hippocampus, and we're kind of bringing it forward into working memory, into the prefrontal cortex and working memory capacities. We open that file, and now that we're actively working with that memory, we get to basically both reduce the intensity of the automaticity of strong emotions, like reducing the amygdala reactivity, as well as integrating new ways of thinking, integrating time orientation that now can be different from then, integrating the resource of the relationship, especially when we're working with relational trauma and betrayals. We get to integrate experiences of self-compassion. And all of that is basically kind of weaving together that old raw memory with new experiences in the present moment so that when that file closes at the end of the session, metaphorically, and it gets stored back in the brain, it's stored in a new form. It's stored with more integrated throughout the brain, integrated into an overall sense of self. And it's not such a raw, hot trigger memory in the brain. When we're working with early childhood, relational trauma, or complex PTSD, very often it's harder to achieve some of those positive gains in our EMDR therapy. There's greater likelihood for dissociation, not chosen dissociation. There's greater likelihood for flooding. And for more cognitive stickiness, if we want to think about that, if we lose our cognitive flexibility, there's more likelihood to kind of drop into worst case scenario thinking or negative beliefs about self in the future that aren't allowing for new cognitive change to occur as we think about that memory. There might be more emotion or sensation intolerance and a much harder time to be with self-compassion. So when Jim Knipe brings in modified protocols, which is what I'm going to share with you for the next little bit here, those modified protocols are basically all to target those typical barriers when providing EMDR for CPTSD. But here's the funny thing is that these modified protocols, whether or not you are trained in EMDR therapy, are very accessible ways of working for everybody. And you can experiment with whether it feels right to add something like a butterfly tap or a tapping of the legs or a little bit of rocking side to side. I love havening touch as an alternate form of bilateral integration when working, especially with loving eyes, if it's a tolerable form of that. So you can kind of play around with how might you integrate this next one, which will be the loving eyes protocol. And then we'll talk a little bit more about constant installation of present orientation of safety or CPAS.